Welcome to AETCM, the Emergency Medicine channel. In this video, we are going to discuss about 4 score. So we have seen the Glasgow Coma Scale before. So it is a neurological scale which is used to assess the level of consciousness. The 4 score is an alternate to this GCS score. But the advantage is that this 4 score can be used in intensive care settings where the patient is intubated, or if the patient is having an altered sensorium, or if GCS will be a limitation to be used in such patients, we can use this 4 score instead. So 4 stands for fully outlined, full outline of unresponsiveness score. So that is what the 4 stands for, full outline of unresponsiveness. So in 4 score we have 4 components. So in GCS we have seen the 3 components, that is the eye, verbal and motor. But coming to 4 score, here we are having 4 components. So in 4 score we have the eye component, we have motor response, we have brainstem reflexes and respiration being the 3rd and 4th components. And in GCS the minimum score that we could give was 3, because in each component the minimum or the least score was 1. But coming to the 4 score, in all the 4 components, the least score that we can give is 0. In GCS it was 1, in 4 score it is 0. And the maximum score is 16, because in each component the score is ranging from 0 to 4. So we'll move on to each component in detail. We'll start with the eye response. So in eye response, as I said, the score will range from 0 to 4. So a score of 4 will be given if the patient's eyelids are open and if the patient is able to track the commands. A score of 3 will be given if the patient's eyelids are open but the patient is not able to track the commands. If I'm moving the fingers, the patient will not be able to move it accordingly. So the patient's eyelids will be open but will not be tracking the commands. Coming to the next one, the score of 2 will be given if the patient's eyelids are getting opened only to a verbal stimuli. If I'm shouting out loud, if I'm giving a loud verbal stimuli, and if the patient's eyelids are getting opened, I'll be giving a score of 2. Coming to the next, a score of 1 will be given if the patient is only, the eyelids are getting opened only to a pain stimulus. If I'm giving a pain stimulus, the patient's eyelids are getting opened. For such scenarios, we'll be giving a score of 1. And coming to 0, if the eyelids are completely closed, even if I give a pain stimuli or a verbal stimuli but the patient is not responding to it, patient's eyelids are not open, so in such scenarios, we'll be giving a score of 0. So I hope this part is clear. We'll move on to the next component, that is the motor component. So these 2 components we are familiar with because we have seen that in the Glasgow Coma Scale. So in motor component, again the score is ranging from 0 to 4 here. There it was 1 to 6. So here the score of 4 we'll be giving if the patient is able to follow the commands. I'm saying the patient to lift the arm up or show a thumbs up sign. If the patient is able to follow the commands, I'll be giving a score of 4. A score of 3 will be given if the patient is able to localize the pain. A score of 2 if there is abnormal flexion. A score of 1 if there is abnormal extension. And a score of 0 if there is no response at all. Coming to the next component which is new to us, that is the brainstem reflexes. So in this brainstem reflexes, again the score ranges from 0 to 4. So in this scenario, we'll be seeing the pupil and corneal reflexes. So a score of 4 will be given if the pupil and corneal reflexes are present in both the eyes. A score of 3 will be given if in one eye if the pupils are dilated and fixed. In one eye if the pupils are dilated and fixed, we'll be giving a score of 3. Coming to the next, we'll be giving a score of 2 if pupil or corneal reflexes are absent, not both. If any one of these, either the pupil reflexes or either the corneal reflexes are absent, if any one of these are absent, we'll be giving a score of 2. And next we'll be giving a score of 1 if both pupil and corneal reflexes are absent. Okay, and coming to the next, a score of 0. So we'll be giving a score of 0 if the patient's pupil corneal and cough reflexes are completely absent. So if the patient is in a complete unresponsive state, all of these reflexes will not be there, and also the pupil and corneal reflexes will be absent mostly if the patient has went into brain death. So we'll be giving a score of 0 in this. Coming to the next component, that is respiration. So it is especially useful in patients who are intubated. So we'll be giving a score of 4. Again, the score ranges here from 0 to 4. So in each component, as I told, in each component in the 4 score, we'll be giving a score ranging from 0 to 4. So in respiration part, a score of 4 will be given if the patient is not intubated and the patient is having a regular breathing pattern. A score of 3 will be given if the patient is not intubated but the patient is having a Cheyne-Stokes breathing pattern. So Cheyne-Stokes breathing pattern is that slowly the respiratory rate will increase gradually, followed by a phase of apnea. This is most commonly seen in patients who are having this raised intracranial pressure. So in such scenarios, we will be giving a score of 3. Coming to the next, a score of 2 will be given if the patient is not intubated but the patient is having an irregular breathing pattern. So in such cases, we will be giving a score of 2. And coming to the next, the patient is having the breaths which is more than the ventilator rate that we have set. For that, we will be giving a score of 1 and score of 0 if the patient is having an apnea or if only the ventilator set rate of the breathing rate is being maintained. The patient is not having a trigger or the patient is not taking a spontaneous breath. In such scenarios, we will be giving a score of 0. So these are the 4 components. So again, we have eye component, the motor, the brainstem reflexes and respiration. And as I have mentioned previously, this is a neurological assessment score which can be used as an alternative to GCS, especially in patients who are having an altered sensorium or if the patient is intubated. So this is especially useful in patients who are in the intensive care settings. So I hope this part is clear, and also regarding the score, it ranges from 0 to 16. So in GCS, the least score that we could give for the patient was 1 in each component. That makes a total of 3 as the least score when it comes to the total score of GCS. But in 4 score, in each component, we are having the least score of 0 and the maximum score of 4. That is uniform. In GCS, we had in one component it was 1 to 4, 1 to 5, then 1 to 6. But in 4 score, for all the components, it is uniform. It is 0 the least and 4 the highest in each component. So the least score will be 0 and the maximum score will be 16 in this patients. So 16 is considered to be the normal and 0 means the patient is in complete unresponsive state. So thank you for watching.